Hi, this is Jeevatnam and welcome to my channel Jeevan Astro Answers. And this topic is about diabetes insipidus. Diabetes insipidus is a rare disorder which it modifies the body to make too much urine. People with diabetes insipidus pee large volumes of urine several times a day, and this frequent urinated condition is called as polyuria. And people with this disorder need to drink a lot of liquids because all the time they feel constantly thirsty. This condition is called as polydipsia. Diabetes insipidus can be chronic, that is lifelong, or temporary and mild or severe depending on the cause. And electrolytes imbalance in the blood, such as sodium and potassium, can cause diabetes insipidus because these electrolytes are very important to maintain the body fluid. Any imbalance in these electrolytes make the body couldn't able to retain the water properly. In order to maintain the body fluid, a patient had to drink enough liquid to replace the water loss through urine. Generally, people are confused with the term diabetes insipidus with diabetes mellitus, but they are not the same disorder. Diabetes insipidus and diabetes mellitus are two distinct conditions with different causes and treatments. The name diabetes comes from the Greek word diabanion, which means go through, because the body quickly go through abundant liquids in both the conditions. They share the same name diabetes because they both cause increased thirst, intake of liquids, and frequent urination. But the word insipid means flavorless, and a primary symptom of diabetes insipidus is the urine will be clear and odorless. In diabetes insipidus, the blood glucose levels are normal, but the kidneys couldn't properly concentrate the urine. On the other hand, the word mellitus means sweet. Diabetes mellitus gets its name from the fact that a primary symptom of diabetes is sweet smelling urine. In diabetes mellitus, the blood sugar is too high. The kidneys are trying to remove the extra glucose by passing it in the urine. It happens when the pancreas doesn't make any or enough insulin, or the body doesn't use the insulin properly. All because insulin is very important to transform the food into energy. And to get more information about diabetes mellitus, refer my diabetes mellitus in Medical Astrology video. Diabetes insipidus is mostly caused by an issue with the hormone called antidiuretic hormone, that is ADH or vasopressin. Antidiuretic hormone, that is ADH or vasopressin, is a hormone that is produced by hypothalamus and the pituitary gland stores and releases it. Actually, hormones are chemical messengers that coordinate different functions in the body, and it carries messages through the blood to the organs, skin, muscles, and other tissues. These signals tells the body what to do and when to do it. The hypothalamus is a part of the brain which that it controls the autonomic nervous system, and also it regulates the pituitary gland. It makes ADH and then it sends to the pituitary gland for storage and release. Pituitary gland is a small gland located at the base of the brain below the hypothalamus. It's a part of the endocrine system, and it's in charge of making, storing, and releasing many different important hormones. ADH helps to regulate the fluid balance in the body. When the kidneys are filtering the waste out of the blood, ADH play a role in the kidneys to maintain the fluids. Generally, the body produces and releases more ADH when a person becomes dehydrated or losing blood pressure. The increase in ADH tells the kidneys to hold more water instead of releasing it in the pee, that is urine. As an example, if a person without diabetes insipidus were in the desert with no access of water, their body would produce more ADH to retain as much water as possible. But a person with diabetes insipidus would continue to urinate water and would quickly become dehydrated. In most cases of diabetes insipidus, the hypothalamus doesn't make enough ADH, or the pituitary gland doesn't release enough ADH, or the kidneys fail to use ADH properly. All in general, this causes frequent and excessive water loss through the urine. The cause depends on the type of diabetes insipidus you have. Types include central diabetes insipidus, nephrogenic diabetes insipidus, gestational diabetes insipidus, dipsogenic diabetes insipidus. In central diabetes insipidus, the pituitary gland or hypothalamus become damaged because of any previous surgery or a tumor or head injury or any other illness. These all may be the reason for central diabetes insipidus. It affects the usual production, storage, and release of ADH. An inherited genetic condition can also cause this disorder. Nephrogenic diabetes insipidus occurs when there is a defect in the structures of the kidneys so that the kidneys are unable to respond to ADH properly. The defect may be caused due to an inherited disorder or may be with a chronic kidney disease. Certain drugs, antiviral medications, or having metabolic disorders, that is, high blood calcium or low blood potassium levels, can also cause nephrogenic diabetes insipidus. Gestational diabetes insipidus are very rare and it occurs only during pregnancy. By that time, an enzyme made by the placenta may be destroy the ADH in the mother. Primary polydipsia, which is also known as dipsogenic diabetes insipidus. This condition can cause production of large amounts of diluted urine from drinking excessive amounts of fluids. Primary polydipsia can be caused by damage to the thirst regulating mechanism in the hypothalamus. The condition has also been linked to mental illness such as schizophrenia. Sometimes there is no obvious cause of diabetes insipidus. However, in some people, the disorder may be the result of an autoimmune reaction that causes the immune system to damage the cells that make vasopressin. Signs and symptoms of diabetes insipidus include producing large amounts of pale urine, being extremely thirsty, frequently needed to get up in the night to urinate, weight loss, confusion, dizziness, sluggishness. It can also cause severe dehydration, which can lead to seizures, brain damage, or even death if left untreated. According to medical astrology, the kidney is ruled by the seventh house and the seventh lord. Jupiter and Moon are the Karga of kidney disease. Venus is Karga of the seventh house, and Libra sign rules the seventh house of natural zodiac. Any affliction to the seventh house or the seventh lord and the malefic Jupiter, afflicted Moon and Venus can cause kidney troubles. A person's daily urine output is usually somewhere around 1 to 2 liters per day. Suppose if you are urinating excessively, that is more than 3 liters per day, and if you don't drink enough fluid to replace water lost through urine, you would become dehydrated, which is dangerous to the health. And also, if the urine appears very clear or odorless or colorless, you should seek medical attention. Without treatment, diabetes insipidus can lead to death in behalf of dehydration complications. Because of this, diabetes insipidus is considered to be a serious disorder. The main way to treat diabetes insipidus is to drink enough liquids to prevent dehydration, but doing so can disrupt your regular lifestyle, including your sleep. So, the proper medical treatment is very important to overcome this situation. But if the diabetes insipidus is treated properly, the condition does not cause any severe or long term complications. The outlook is good for those who receive treatment and medications, which can help them to keep their health stable. I hope you might have received some important and useful information from this video. We will meet you soon in my next video. Till then, take care and bye.